Welcome back to Ethnic Health America. Our discussion on HIV continues. Our special guest, Catalina Palacios. She is with the Clinica de la Raza, and she deals with HIV in youth. Thank you for joining us.
Thank you for having me.
Tell us a little bit, how big a problem is HIV in youth, and is it expanding?
It is. It's a huge problem, especially amongst youth between the ages of like 13 and 24. Oakland is considered a hotspot for HIV as well as other STDs.
Now, obviously we know that HIV is a disease that once you identify it can be treated. But that's not the whole story, just the medicines, is it? I mean, they need other services as well.
Yeah, there's other services. A lot of people tend to think, okay, well, go get tested and then you get on medication and then you're going to be fine. But then people deal on an individual basis. They deal with many different issues. Some being mental issues, such as depression. Sometimes they're dual diagnosis. And then there's also the issue of substance use, especially among youth.
How do you organize to take care of all of these problems once a child has been identified, not a child, but a young adult has been identified?
So once a young adult or a teenager, we work with teens, has been identified as HIV positive, there's something that we called warm hand off. So it's they'll come in, they'll get their results, and then immediately we start assessing to see where that teenager is at and what type of services do they need. Sometimes they just need some time to sit with their, with the news that they received. Other times they're ready to get services. So we immediately, connect them with medical services if they need mental health services. We also have that in line. And then we just take it from there.
Now, what about parents? How do they get involved when teenagers are diagnosed with HIV disease?
They usually become involved if the teen wants them to become involved. So that would be the teenager's responsibility to notify the parents. And there are programs that can also help with that, with letting family members know or even contacting partners, sexual partners that they would like to let them know about their HIV status.
Now, does any patient with HIV have to tell you who the partners are, or is that just volunteer information?
That's voluntary information. Yeah.
Now, when you think about the burden of this place, are most teens really aware of the serious nature of the issues that they're dealing with?
I think that they are. I think that sometimes we underestimate how much aware are they of their surroundings or their situation. Part of what we do is we go out into high schools here at, in Oakland, and we do a prevention curriculum with them. It's an 8-session, and we talk about HIV in the world outside of their community, and then we bring it back to their community. And the different challenges with that, how HIV is spread, how can you prevent it, what are the cofactors, of HIV infection. And they know all this information. I think they're very aware. But there's other things that go along with it. It's not just giving the youth the information on HIV, but it's also how can you use this? Do you feel comfortable to have your partner's use of condom? Do you know where to go get condoms? Do you know how to put on a condom? So it's, different stuff like that, the different issues.
Have you seen over the course of your professional career the attitude toward HIV disease change within the Latino community in terms of testing and getting the word out?
As far as the Latino community, I think we've come a long way with HIV, but there's still a lot of work to be done. And it goes, that you have the younger generation who are coming in and they are getting tested and they do want to know their status, and then you have an older generation that's still very traditional, you don't talk about it, that are still trying to figure out, how is it transmitted, so it varies, but we have come a long way with HIV. Unfortunately, a lot of people within the African American community and the Latino community, they find out their HIV status sometimes in the emergency room. They're at a point where HIV has developed into AIDS and they're admitted into the emergency room, and that's how they find out their status. And that's what we want to prevent. We really want to encourage people, and we always tell people, especially young people, if you are being sexually active, get tested for HIV at least twice a year. And because the sooner that they know the status, the easier it is to get treatment and and prevent it from developing into AIDS.
Now, how long have you been doing this?
I've been working in the Fruitvale community doing different work. I started off with doing substance abuse prevention like about 12 years ago. And I started shifting doing HIV prevention, then eventually it just combined. And I've been doing it for like about, I'd say, 15 years.
And what is the most satisfying thing about your job?
Working with the youth. Working with the community in general, when you're giving out information and when you see a teenager or a young adult, that comes back after you've been teaching them in the classroom for 2 weeks and they come back and they ask for condoms, or, when you're giving an HIV test and they're asking all these questions, or, just to be out in the community and giving out information, because this is information that could save somebody's life, or to hear, that they remember your name.
Well, Catalina, thank you very much for the work that you do in the community and for the work that La Clinica does. All right, we'll be right back after this break.
HIV and AIDS and just sex and sexuality in general is still very much a taboo, still very much stigmatized. And when that happens, that propagates, unfortunately, new HIV infections. And unfortunately for the many communities that we work in, many individuals are testing very late. Their disease is advanced to an AIDS diagnosis, so they're fighting opportunistic infections already.
Yo llegué al hospital con diversas enfermedades oportunísticas en mi sistema inmunológico. Después de 12 días que trataron de parar la fiebre, trataron de parar el vómito, miraron que no podía parar, me decidieron hacer la prueba de VIH y el resultado fue que tenía yo ya SIDA, tenía solo 14 células de defensa. Yo pienso que sentía que la tierra se abrió y me estaba comiendo por pedacitos ya, me sentía morirme.
With HIV patients who are new, they've generally not been in care and they didn't know that they were sick and they think that they're going to die and they are ashamed to have the disease. And so our first goal with patients is just giving them a sense of hope and saying, we can get you back to a better state of health. The services that we have at La Clinica, which are excellent services, were often underutilized or not used at all by our HIV patients. And over time we realized that it's better to just bring the services over here. And in that sense, we are a kind of patient-centered medical home.
Ahora vengo precisamente porque voy a empezar mi tratamiento de medicamento para HIV.
Y usted sabe de la importancia de tomar las pastillas todos los días. We provide clinical services, of course. We provide nutrition services, mental health counseling, risk factor reduction services. And so all those services, we found it's really best to provide them here in the clinic so they don't have to go anywhere else.
We know them individually on a first-name basis. We know about their lives, if they're married or not married, if they're gay or not gay, if they have children. And I think we have a bit more of a personal touch.
La gente es muy amable, no te ve diferente.
Me siento muy contenta de poder recibir ayuda y consejería con Marta o con Alicia Díaz, que me da terapia. Me escucha y siento que me están sirviendo mucho. Para mí y para mi familia también. Ella es como una amiga para mí también.
Trucha is one of the oldest sections of the Community Health Education Department here at La Clinica, providing HIV and AIDS education and prevention services. We provide services to pretty marginalized communities, including the transgender community, intravenous drug users, sex industry workers, gay and bisexual men or men who don't identify themselves sexually, and just community at large. We hand out over 20,000 condoms a year. We also offer testing, specifically focusing on those who are at highest risk for HIV. We're becoming, again, a trusted source in the community. Individuals who are at very high risk are coming to us, or we're reaching them through the testing that we do out in the community.
People who live with HIV tend to be people who have experienced rejection, discrimination, prejudice, and I'm hoping that I can be here for them, like Clinica can be here for them, that they at least feel like they have somewhere to go.
Your contributions and your support enable us to have a visible and an impactful dent in HIV and provide an array of very, very needed services to individuals that are living with HIV.
Todavía tengo vida y la salud que tengo la quiero disfrutar con mi familia, que Dios me permita vivir.